Hello and welcome to the Forgotten Trimester YouTube channel where we discuss all things postpartum and motherhood. I am your host, Dr. Megan Gray. I am a board certified practicing OBGYN and mom of two littles. On this video, I want to chat about the types of pain that you may experience after your cesarean section. So we usually categorize the types of pain that most people will experience after their cesarean section into 5 different categories. Number 1 is gas pain. Number 2 is incisional pain. Number 3 is uterine cramping / contraction pain. Number 4 is muscle wall, abdominal wall pain. And number 5 is joint pain, like your hips, your back. So let's dive into each one of those categories individually. And you might notice me looking down because I want to make sure that we're covering every little thing. So let's start with number 1, gas pain. Gas pain is incredibly painful and it takes most of my patients by complete surprise. No one is expecting it and it is unreal. So most people will describe it as a sharp stabbing pain that kind of moves around in the abdomen as the bowels are trying to move around to push that gas out. This pain can be more painful than the actual incision pain. So don't be surprised by this pain. It is going to be uncomfortable for you, but a lot of times I feel like just the alarm of the pain that's like, oh my gosh, what is going on? What is this pain? Makes the pain even worse. So I think if you kind of prepare yourself and understand that this is a type of pain associated with cesarean section, it may not be quite as painful. So when does this pain become abnormal? When this pain is associated with nausea and vomiting, you need to let your postpartum nurse know or your physician, okay? This needs to be further evaluated. If you are having this gas pain and you are puking everything up, it needs to be further evaluated. If the pain is actually worsening despite the fact that you've started to pass some gas from down below, you probably need to keep a close eye on that and let your physician know. If you're having this pain and you have not started passing gas from down below within about 48 to 72 hours after your C-section, please let your nurse and your physician know so they can keep a close eye on things and do further evaluation if necessary. 3 tips that you can consider and use as far as managing gas pain is 1, to get up and move around as soon as possible and as frequently as possible. Usually within the first 12 hours, making some laps in your room if possible, even in the hallway if possible. Number 2 is chewing gum. There's multiple studies to show that people that chew gum post-operatively, so after their surgery, they have an improvement in bowel function faster than those that don't. Number 3 is Mylicon or Gas-X. That medication helps break the gas up and make it a little bit easier to pass. So that kind of covers gas pain. I just want you to be aware of that so it doesn't take you by surprise, or if you're already experiencing that, know that it can be very normal. Number 2 is incisional pain. So this is pain directly at the incision site, right at the skin, people can point right to the incision and say, I have pain there. This pain can typically be sharp or searing, like something's burning, or it can sometimes feel like something's ripping or tearing. It is usually the most intense the 2nd and 3rd day after your C-section. So the first day of your C-section, you're pretty well covered by the medications that the anesthesiologists use to help keep you comfortable during your cesarean section. But day 2 and day 3, all that medication is wearing off. You're taking oral medications. You're gonna start to feel that discomfort. And that's okay, that's normal, but you just need to be aware that that's gonna happen. It is probably going to be more painful when you do certain activities, like getting out of bed. I mean, when I tried to get out of bed, I had a cesarean section for both of my births. When I tried to get out of bed, I mean, I was holding on to everything I could reach my hands to, trying to brace myself getting out of the hospital bed because it was so incredibly painful. So there are definitely techniques that you can use to help make it more comfortable and ease the discomfort getting in and out of bed, which I will follow up with a separate YouTube on that. But just be aware that that activity, those first couple days is intense, and that's probably when you're gonna feel that discomfort the most. Another activity is like bending over and standing back up. If you don't have to do it, don't. Or trying to lift your legs, like trying to put your underwear or your clothes on. What? So uncomfortable. Like I was in the bathroom trying to pull my underwear back up after my cesarean section. I was like, oh my gosh, I can't even clothe myself right now. So you are going to need some help, whether it's your nurse, your partner, a friend, for those first couple of days, because even just trying to lift your leg and put your foot in through your underwear and pulling it up is pretty intense. So what to look for, what's the red flag with this type of pain? If you're having that pain and it is not controlled by pain medications, your nurse and your doctor need to know. If the pain is worsening after the first 72 hours instead of slowly improving, your nurse or your doctor need to know. So this pain should be the most intense the first 48 to 72 hours after birth, and then slowly each day improve. But if you're noticing instead of improvement that it's getting worse and worse and worse, it needs to be further evaluated. If the pain is worsening and it's associated with nausea and vomiting, it needs to be evaluated. Any nausea and vomiting associated with these type of pains needs to be evaluated. If you are developing a fever, so a fever after a cesarean section is considered 100.4 or greater. If you're noticing that, that needs to be evaluated. If you're noticing redness, swelling, drainage from the incision itself, alert your physician so they can evaluate it. Okay, so that takes care of incision pain. The third category of pain is uterine cramping and contractions. And holy cow, another type of pain that just totally blows people away, and like they're so super disappointed when they feel it because they're like, oh my gosh, I just went through all this and I'm still having contractions. What the heck is this? So very, very normal. You are going to feel that for the first 3 to 4 days, and then it will subside. So no worries. It's not going to last forever. But it can be pretty intense. I mean, some of my patients will tell me that this type of pain is actually more intense than labor contractions. Now, usually those are people that have had multiple babies. But that being said, people feel it and they will liken it to labor. So don't be alarmed. There's nothing wrong with you. You will potentially feel uterine cramping and contraction. So either period-like cramps or like contraction type pain. So you will notice if you are breastfeeding that this pain worsens during and just after breastfeeding. And so here's what's going on. Your body is extremely smart. We've been living for thousands of years on this earth, and our bodies have developed ways to protect us. So one of the ways to protect us during childbirth is that when your brain secretes the hormone called oxytocin, which is a hormone associated with breastfeeding or with physical touch, so hugging, holding hands, all that will secrete oxytocin from the brain. So when that's secreted, not only will it tell the breast to let down milk, but it also tells the uterus to contract. And reason being is that most people that are breastfeeding are just postpartum. So you want that uterus to contract and stay firm and contracted to prevent heavy bleeding after delivery. So really cool, right? Our bodies are super smart. So don't be alarmed by that. You can do lifestyle modifications like warm compress to your belly, warm compress to your back. You can get in a warm shower. You can do non-steroidal anti-inflammatories like ibuprofen or Motrin if you are not allergic, or Tylenol, although Tylenol doesn't work quite as well as the non-steroidal anti-inflammatories like ibuprofen and Motrin. Be sure to talk with your physician, however, before starting any of those medications to make sure that it's not going to interact with anything else you're taking and that it is safe for you to take. Things to look out for with this type of pain. So red flags for this type of pain after a cesarean section. Number one, if you are having heavy vaginal bleeding associated with this type of pain, so you are passing, small orange type clots, so a small baseball, a nectarine size clot, that's too heavy. Or if you are fully saturating a large maxi pad every hour or greater, that's too much bleeding and that needs to be evaluated. Number two, if you are having, once again, a fever, 100.4 or greater, associated with that cramping pain, that uterine cramping pain, please let your physician know so they can further evaluate it. Okay, so that covers uterine cramping pain. So we're going to next, number 4 is muscular pain, so abdominal wall pain. When we do a cesarean section, we don't cut the muscle. Everybody thinks we are cutting through muscle. We're not cutting through muscle. You have this thin piece of tissue in between the two muscles of your abdominal wall on either side. We spread the muscles in the middle, which for a majority of women, the muscles are already a little separated to accommodate for the enlarged uterus. Then we kind of manipulate and pull and tug, and that obviously irritates those muscles and causes them to spasm. Anything that irritates musculature can cause spasming. And it causes inflammation too, and inflammation causes pain. So after the cesarean section, you may notice that your abdominal wall is sore, tender to the touch, almost feels like bruised. So people will say it's a burning or a sharp or a bruised type pain. It occurs most often when you're doing movements like getting in and out of bed or putting on undergarments or clothes, or with cough, laugh, sneeze. And that's gonna be the worst thing ever. You hear somebody comes into your room and you're one day post-op from your C-section and they make you laugh. You're like, oh my gosh, don't make me laugh. That's the worst thing ever. So one thing you can do, lifestyle modification for when you cough, laugh, sneeze after a cesarean section, is take a pillow and push it up against your belly gently but firmly, right as you are starting to cough, laugh, or sneeze. And that kind of braces your abdominal wall and will make it less uncomfortable, but will not completely resolve the pain with cough, laugh, sneeze after a cesarean section. Red flags of this, once again, if the pain is worsening over time instead of improving, that warrants further evaluation. If your pain is so intense that you can't even touch your belly, like I can't touch my belly because I will jump out of this bed, it is so painful, that needs to be evaluated immediately. Do not wait. Call your nurse in, call your physician in. That needs further evaluation. And once again, fever of 100.4 or greater associated with this type of pain needs further evaluation. Okay, so that wraps it up for muscle pain. Then the fifth category of pain is hip and joint pain. So even though you didn't push a baby out of the vagina, you can still have pain in your back. So those are all ligaments along your spine. Pain in between your spine and where your hips kind of connect to your spine. Those are all ligaments. You can have pain in the front over your pubic bones, that big bone in the front. There are ligaments in between the hip bones there. You can have pain in your hips where your hip joints are. And that is because every pregnant woman, no matter how you end up delivering, produces a hormone called relaxin. And relaxin is a great hormone because it tells your ligaments in your body to relax, hence relaxin. But what that does, it allows for the hips to expand to accommodate the baby's head coming down into the pelvis. So even if you didn't push a baby out, that happened. And so it can almost feel like your joints are out of alignment. Your spine is out of alignment. Your hips connected to your spine are out of alignment. That joint in between your hip bones in the front is out of alignment. And so people can have pain with walking, they can have pain with lifting their legs, they can have back pain, they can have buttocks pain, they can have pain that radiates down their legs, all associated with this joint pain as a result of the change in the ligaments in between the joints. So it can feel like nerve pain, so like sharp shooting pains radiating down your legs or into your groin. It can be buttocks pain. It can be pain right over your pubic symphysis to feel like almost like your hips are dislocated. It can be pretty intense, or it could just be that nagging, annoying pain, like almost like a sports injury type pain. So some red flags to look out for this type of pain. If you are unable to walk because you are having this type of pain, if you are unable to bear weight, or your legs feel weak and you can't walk because you feel weakness, that has to be evaluated. And your physician will evaluate it and also will get physical therapy involved as well. If you are unable to walk because you feel unstable, like your joints feel unstable, they feel disjointed and out of whack, that should be evaluated. So weakness, instability, significant pain to the point where you can't walk. All of those need to be further evaluated. I am a huge proponent of pelvic floor physical therapy for anyone that's ever been pregnant, but especially people that have cesarean sections. There is a disruption of the abdominal wall where the abdominal wall muscles connect to the pelvis. All of that, they all work together to stabilize the spine and the pelvis. And so pelvic floor physical therapists are amazing at coming up with techniques and exercises to help strengthen and stretch all of these muscles and ligaments to make you as efficient and comfortable in your movement with your hips and your spine as possible. So that is it, guys. That's what you can expect from post-operative pain after a cesarean section. If you like this information, please share it with your friends. If you have a friend that is going to have a cesarean section or had a cesarean section and is freaking out, share this episode with them. If you like what I am presenting, please subscribe, give me some thumbs up, ask questions. All of this helps me come up with other topics and keeps me going. I love to teach and I love questions. If you aren't already following me on Instagram, check me out there. Got a lot of free information about all things postpartum on Instagram. I'm sorry, my dog has decided to bark. And I have lots of free downloadable information that you can check out in my bio on Instagram. So please, please, please check that out. Super helpful information. I am here to help you guys. I am reaching beyond the delivery room to help make the postpartum experience the best that it can be. All right, see you next week. Bye.